Hi, Jamie Davis from The Nursing Show here at the ANIA Conference 2016 here in San Francisco. And I'm here with Martha Badger, who is one of our poster presenters here. A lot of good research coming out here on nursing and health informatics. And Martha, before we get into your poster presentation, I always try to ask our nurses why you wanted to become a nurse.
That's an excellent question. I think, like anyone who's interested in healthcare, you think about medicine and so on. But I happen to be living in West Africa and volunteered at a clinic in Cameroon and realized the amazing role that nurses have in healthcare. That really opened my eyes. And so when I got back to Canada, which is where I'm from originally, I did a nursing program and went straight to the developing world in my own country up on the Indian reserves of northern Canada. And since then have, done a variety of things. Now I'm actually 25 years into my career and almost finishing my PhD. So there's no end in sight to personal and career development for nurses.
That's fantastic. Now, how did you get into nursing informatics? Because it sounds like you've been in a couple of different roles over the years.
Yes, I have. I was an emergency department nurse and a care management nurse for HIV/AIDS patients. It's a long list. My husband likes to look at my resume to keep track. And informatics, I'm of that generation where I happen to be working in a care management position, and they were implementing a new software program, and they were looking around for people they thought might have the skills and the drive to participate in the implementation, and I'm very grateful to have been one of the people who was chosen at that time. And it morphed from there. I've been in that field for close to 10 years now and did my master's in informatics, and as I said, the doctoral program in informatics. So it's just become a passion. I knew right away. Because I'm not a nurse practitioner insofar as having a specialty that way, but I do have a specialty in informatics.
It's amazing, and I've heard that kind of a story where they implemented something new technology-wise, and then they had to find nurses that were willing to branch out and try something new, and you're just another person with a similar story.
It's true, and I feel grateful because you know how quickly things move in technology, and that kind of story, yes, you'll hear it often from older sort of nurses, but now more and more people are going to do their masters in informatics, and so they're the people of choice for those sorts of jobs. So it used to be that you got into a job and then that was the next thing you did school-wise, but now people are going straight to informatics and getting the positions in informatics. So as I say, technology changes, and so has this generation has already changed in 5 years or so.
Excellent. So what about the research you're presenting here? What was the thing you were trying to figure out, and how did the data end up falling?
Sure, no, that's an excellent question. It's a pilot study for my PhD, and what I am very interested in is all the documentation that nurses do in the electronic health record. Okay. Nurses have documented even before there was an electronic health record, and there are many good reasons to document. But I wanted to be more than an electronic filing cabinet. It's useful for patient histories and so on, but how could we use it to predict and help patient outcomes? So where I work, they do use nursing documentation in the electronic health record to generate patient acuity scores. And that's wonderful. So my pilot was to make sure that was working. Is there definitely a correlation between patient acuity and nurse staffing? And there is. So now I'm able to take that patient acuity tool a step further, and I'm going to use it to predict patient outcomes, hopefully. So patient acuity will be part of a predictive model, including various other patient traits. That's, to show all that documentation is worthwhile. And then the nurse-sensitive patient acuity can also contribute to what we know is going to happen in the future to the patient if we're able to reduce length of stay, get people into facilities sooner than waiting for a Thursday to arrange for home health care. It's all about identifying patients who are at risk for length of stay and discharge dispositions that put a heavy burden on the healthcare system financially.
Yeah, it's fascinating because we think about technology in the healthcare or workplace and with the patient care arena, that we're really thinking about the different things like the IV pumps and the health record, obviously, and all the technology that come together, and we wanted to talk to each other and do all those things. But yeah, the next step really is, can it be and help us be more intuitive about what's going to happen with that patient? And it's really interesting to hear you saying that you're looking at a way where maybe we can apply that data to do that predictive modeling.
Correct, and it's the present and it's also the future. People talk about population health, predictive analytics, and my current role is in the predictive analytics role, so it's meshing nicely with my doctoral studies, and I feel confident that I'm going to be challenged and stimulated for another 25 years to come.
What's the response been so far? Have people taking a look at your poster?
They've appreciated it. I think it's really interesting to be here in California where they have the mandated ratios. So even though they have mandated ratios, they still need to have a patient acuity system. So it's garnering more interest than I had anticipated, because I thought, well, in California, yeah, sure, we have 9 patients, so we have 3 nurses. But I've had a great response to people who are interested in research, for themselves, to be inspired that they can really choose a subject that's makes them feel like it's worthwhile and that they're passionate about. So that's nice also to be a bit of an ambassador for higher education in that way.
Excellent. Well, thank you so much for coming on the show and chatting with me, and good luck with the rest of your research and your PhD process.
Well, thank you. It's been a pleasure.
And I want to thank all of you for checking out this segment here from the ANIA, or ANIA conference. You can find more videos like this one over at ania.org, or you can also find them over at NursingShow.com. I'm Jamie Davis. I'll be back with more segments like this one soon.